Dr. Kanchan Kaur, Senior Director for Breast Surgery at Medanta, and I would like to talk about the services that the Medanta Breast Service brings to patients who have breast-related issues. Breast cancer has become one of the commonest cancers that women in India are facing nowadays. And to deal with breast cancer in the proper way requires a multi-speciality setup, a multidisciplinary approach, and a highly individualized approach for every cancer patient. For breast, there are three main services that we look at providing. One is the screening service for those who have no problem. So we provide screening for women 40 and above by doing regular mammograms at our executive health check floor. And for women who are under the age of 40, we run clinics where we talk to women about the importance of self-examination, and we include a clinical breast examination once a year starting from age 35 onwards. In India, the commonest cancers in the breast are seen between the age group of 40 and 50 years. And sadly, we see more younger cancer in India as opposed to the West. So even girls under the age of 40 need to have some sort of screening, and for that we recommend that they get regular clinical breast examination done, which we offer from the age of 35 onwards. Also, as part of our will to take this message forward that breast cancer must be detected early for proper treatments, we do a lot of awareness programs and we do a lot of outpatient in the community work where we do breast cancer related awareness. So this is one component, which is screening. The second is obviously treating a patient who has been diagnosed. And again, this is a very multidisciplinary approach. We have the concept of the one-stop clinic in our breast clinic, which means that any woman who comes to our clinic with a symptom in the breast, say it could be pain, it could be lump, it could be discharge from the nipple, the first thing that happens is that we do a clinical evaluation, and then as part of triple assessment, we work it into a one-stop clinic, which means that on the same very day, the patient has her breast imaging, which could be mammogram or ultrasound, and where required, a needle biopsy. So doing a one-stop clinic service affords the patient that confidence that they have come with a symptom and they don't have to wait too long to get an initial idea at least about what we are going to do and what the disease is going to turn out to be. In the clinic, we have in our radiology setup, we have the state-of-the-art 3D tomo mammogram machine, which allows us to take 3D views of the breast, which has a much better resolution than a 2D mammogram. And nowadays, as part of standard guidelines for screening, we advise a tomo mammo over a 2D mammo. Also, for patients who require an ultrasound, the radiologist who is present, the services in the hospital are highly specialized, and we have highly trained breast specialist doctors who run the radiology setup and who provide image-guided biopsies of lesions that the patient has been detected with. And this image-guided could be either be through a mammogram, which is called a stereotactic biopsy, or through an ultrasound. Also, we have the state-of-the-art MRI machine available in the hospital, and Medanta is proud of being one of the first hospitals in the country to start MR-guided vacuum-assisted biopsies. So for lesions that are seen only on an MRI and cannot be detected on mammogram or ultrasound, we have the facility to biopsy this through MR-guided biopsy, which is done by our specialist trained radiologist. Once the patient has the biopsy being done, it goes to a specialist trained pathologist who is part of the entire teamwork, and a diagnosis is made. Once the diagnosis has been made, any further tests like PET-CT are all in-house, And all these tests are then discussed in our multidisciplinary tumor board meeting, where the radiologist, the clinician, surgeon, oncologist, all of us sit together and decide what is the best way going forwards for the patient. Now coming on to the treatments which are surgical. Medanta again has the state-of-the-art facilities available for the entire range of surgeries that can be done for breast, be it for benign or non-cancerous lesions or be it for cancerous lesions. So we regularly do breast conserving surgeries. We do all types of oncoplastic breast surgeries so that we can give the patient the best cosmetic outcome. We work closely with our plastic surgical department, and for patients who need to have the total breast removed, we have all the facilities available to do a reconstructive surgery, which could be tissue based, where we take tissue from other parts of the body, or which could be implant based. Again, this is a team-based approach where the breast surgeon and the plastic surgeon, after counseling the patient, do the reconstructive surgery as per the patient's wishes to give her the best surgical outcomes. Now for the axilla, which is the armpit, whenever we are doing surgery for the breast, traditionally all lymph nodes used to be removed, but we perform what is called a sentinel lymph node biopsy through a dual dye technique, in which we get radioactive dye injected and also use a blue dye. Both these dyes allow us to correctly and accurately identify the sentinel node in the armpit, which then undergoes frozen section whilst surgery, and then the need for removing all the lymph nodes is decided on the table. For patients in whom we do need to remove all the lymph nodes, we have over the past 2-3 years now started doing a procedure called lymphovenous anastomosis, in which the plastic surgeon with microscope guidance anastomoses the tiny lymphatics that have been cut and come from the arm, and they anastomose these to vessels within the armpit. Doing this procedure is known to reduce the risk of lymphedema, which is a complication which happens in patients in whom all lymph nodes from the armpit have been removed. So for breast surgery, right from saving the breast to trying to save the lymph nodes in the armpit, to recreating a new breast, to recreating cut lymphatics in the armpit, we do this all under the umbrella of the breast surgical team at Medanta. Also, we run the family history clinic. So for patients who have a strong family history of breast cancer, we advise them and guide them on how regularly they should be doing their screening. We now even have BRCA1 and BRCA2, which is the gene testing. It is done in-house in Medanta now, and our turnaround time is about 2 weeks or so. So the patient can come to know soon whether she has that mutated gene which increases her risk of developing a breast cancer, and if that be the case, we guide the patient on risk-reducing surgeries for the breast as well as for the ovaries. The ovaries is looked after by our onco-gynae team at Medanta, and for the breast surgical team routinely performs risk-reducing surgeries with primary reconstruction for those women who have a strong family history risk and have been proven to be BRCA positive. So this is the kind of service, right from screening to awareness in the community to the entire gamut of diagnostic procedures, along with the surgical treatments that we perform at Medanta. Medanta has a very robust medical oncology setup where expert chemotherapy advice is given, and also a radiation setup where expert radiotherapy's advice is given. So a patient who has come to Medanta doesn't need to look outside anywhere. We provide everything as part of our multidisciplinary team, and for patients who have been treated for cancer, we have right from dietetic and nutrition advice to support groups for cancer to counselors who are on board, so that the journey of a survivor and the survivorship program for the patient can be made so that they can lead normal lives after they have been treated for cancer.